Thanks, Sarah. Oh, perfect. So I wear a few different hats, and I thought I could try to bring all of them to bear and just talk for a few minutes about a lot of different ways in improving our ability to choose wisely. So I am a practicing cardiologist at UCSF, and I've been there for 23 years. And I am, as Sarah mentioned, editor of JAMA Internal Medicine, and I'll talk a little bit about that. And I also work on some technology assessment panels, including one that Trent chairs and Medicare coverage that Patrick chairs, probably went off. And I think there's potential in those to also improve our ability to choose wisely, as well as the IOM committee, Better Care at Lower Cost, which I think has really advanced the ball. And so I was very lucky as a medical student at University of Pennsylvania to be mentored by John Eisenberg. And I think I started, more than 30 years ago in my medical education thinking about how to choose wisely as I continue through my career. So this first is the Less is More, which I launched with Deborah Grady at the journal. At that time it was Archives of Internal Medicine, now we're JAMA Internal Medicine. But we really see Less is More as a big part of our ability as a journal to help providers as well as patients and everyone else, and we hope lots of people read the journal. Well, the reason for Less is More, and I think it is in your handout, we really started this after the U.S. Preventive Services Task Force issued the mammography recommendation in 2009, which I'm sure you all recall, suggested that there were more harms than benefits for women between the ages of 40 to 50 in getting mammography. And as you recall, it got a very negative reception. And as I will say since then, there's been some data suggesting perhaps women in all age groups are getting more harms than benefits from mammography. But at any rate, Deborah and I were talking about what was the reason for that negative reception, and it certainly seemed to us that a lot of the reason was the harms message wasn't emphasized because, I'm not sure that patients really care about cost very much in our current system, but certainly everyone cares about harms. And if you really understood that you were going to have a much higher chance of being harmed than benefited from any kind of test, I think you would think differently, certainly, about the test. But we didn't think that that message was really coming across very strongly in medical journals or in the popular press. And that was why we launched the Less is More series, where we highlight areas of healthcare that have no known benefit, and there actually are quite a few. And then we talk about what are the harms. And because really, if there is no benefit, we feel that a harm, no matter how small, is still going to tip the equation. And so that's one way that we try to improve people's ability to choose wisely, is just to make it more clear what the choices are and when the choices are not favoring the intervention. So in terms of engaging providers, I think certainly journals as well as continuing medical education is a good way to help providers learn how to choose wisely. Quality measures, I was talking with Beth McGlynn a little bit earlier. I think they are good, although honestly at this point I think we have way too many quality measures and it's kind of interfering with physicians' ability to take care of patients. But report cards I think we're seeing a little more of, and I think they can be potentially an ability to help physicians choose wisely. The Switzerland example is from, actually I talked on Less is More at the Society of General Internal Medicine meeting last year, and they were telling me that they actually all the physicians in Switzerland get their report cards and are told how they do on a number of different measures compared to other doctors, and they think it's a very effective way to try to improve, for everyone to improve their own care. And so going just back to the Less is More, we really emphasize, and I emphasize again when I attend on the medical service at UCSF, that and it has to, I think, be part of the medical education. I did see someone here from AAMC, but I think we need to have more clearly in a lot of parts of medical education, starting with medical school residency training and certainly on, that we really do need to consider risks and benefits, because I think right now we have a sort of culture that embraces new things, but without really thinking, is this an improvement on what we have? do the benefits outweigh the risks? And I think we can do a lot better at informing our patients, because certainly in my own field, if you take PCI stents as an example, most people still think when they get a stent, it's because it's going to save their life, prevent a heart attack, even though study after study show that stents compared to medical therapy are not going to save your life or prevent a heart attack. So I think that we can do a much better job of not only informing ourselves, but informing our patients and helping all of us to choose more wisely. I'll just go through the next few examples. One way is the top 5 list. The American Board of Internal Medicine Foundation launched the Choosing Wisely campaign. We published this in the archives a few years ago. It was the first of what is now many different top 5 lists. This one was from primary care. And basically, it really, I think, was very important in involving professional societies and getting doctors to start thinking about, okay, what are some things that we're doing that we should be doing less of? And also, Consumer Reports partnered with ABIM Foundation to try to get the word out to consumers or patients. What are the things you should be questioning or asking your doctor if they suggest these tests? There are a lot of different reasons why I think we do have overuse. As I said, I think there is a lot of enthusiasm for new technology. I'm not sure how big a factor it is, but defensive medicine is always cited as a reason for ordering unnecessary tests. I think misaligned incentives, I thought Sarah's slide was great in showing how we all have kind of different things that we value, and there are so many different players in the system, but we really do need to align incentives. And I talked already about the glamour of technology, why we think about zebras. This was another example from our Less is More series in the journal, where this was actually a case of a physician kind of innocently ordered an extra test. In this case, it was a CT scan for a woman who was clearly very low risk, had very unusual chest pain. And that CT scan led to a cascade of events actually ending up in a heart transplant. And we published, Deborah Grady and Mitch Katz and I published an editorial just to point out that a lot of tests are ordered just because you get more information, but that it's not always necessary. And even what seems like the most innocent imaging test, things can go wrong. Not that that happens usually, but as I said, it really is just part of the message. If there is no benefit, no reason to do the test, you can reassure a patient by talking to them, which I think patients would actually benefit a lot more from, and that we don't need to be ordering the tests. So in terms of patients, I think we are working and having more activated patients is one of the terms I hear. But so patients feel empowered, because I think it is hard as a patient. The power relationship in a doctor-patient relationship is really not equal, but that patients can feel more empowered, and Choosing Wisely campaign is helping to ask more questions. What are the benefits? What are the risks? And how will this test or procedure actually help me? And can I do equally well without getting this test? And also to consider the harms. What's the price of, with a lot of extra tests these days or imaging, you see something incidentally and then you're down another path. So to consider all of these things before we go ahead and order extra testing. All right. And this was some of the graphics that were prepared by the wonderful IOM staff from the Best Care at Lower Cost report. And you've seen kind of this cycle, but it really shows a lot of what we were talking about earlier on the first panel, how the interactive networks of patients, clinicians, and communities can work together. I thought that was a fantastic, pragmatic clinical trial in terms of getting data faster and getting answers faster. And just some of the characteristics of the learning healthcare system are the science and informatics, the patient and clinician partnerships. As I said, I think aligning incentives is a really important part of it and helping to move things faster. I think those things are happening, and I think this conference is going to help us to kind of come together in more and different ways. I hope lots of people are sitting next to each other and come up with lots more ideas. and certainly performance transparency. I think we are seeing more of that, the open data movement, physician, even CMS releasing physician payment data, but I think having a lot more data and a lot more transparent data, because certainly we can't improve our healthcare system unless we actually know what we're doing now and where we want to be headed. So my last slide is just which I just threw in, was just show an example from UCSF. My department chairman, Talmadge King, is very supportive of the whole choosing wisely concept, and his as part of our newly founded Center for Healthcare Value, there's a Caring Wisely initiative, and so he's actually put the hospital and the department have put some money and energy into people submit projects and say what could they do that would save the hospital money and also provide better care. And so some of the starting ones were changing patients from nebs to only using nebs for 24 hours. And there's actually now pictures all over the hospital with Talmadge, and it says nebs no more after 24. And it was because they're very expensive and there isn't any data to suggest that people need them or benefit from them. And that was a successful campaign. The next one was having earlier switches from IV to PO antibiotics when needed. But at any rate, I think there are a lot of opportunities in lots of different ways. All of the stakeholders can work together to help us choose and care more wisely. Thank you.